So I went to the doctor and realized that I needed a hip replacement. I was going to do it in Mexico, but as the time went on, I did all the tests, but I realized I wasn't feeling very confident with the surgeon, not at all. And so one evening I wrote an email to a hospital in Mexico City, and I wrote one to Lyfboat. In the morning, Mexico City had not written back to me, but Dr. Suneet had sent me a message saying, Sharon, within 24 hours, I will give you everything that you need. And I was very impressed that within 24 hours, I had 4 pages on my wonderful doctor and all his qualifications, and 30 pages on the hospital. I also had the price, what it included, what it didn't include. And so straight away, I've been to India before. I know the technology is very high. They also gave me the option of robotic surgery, which I was very impressed without even asking for it. And so immediately I packed my bags and spent 3 days to fly to New Delhi. From the minute I arrived, there was somebody waiting for me. Everything was arranged. I met my wonderful surgeon who straight away gave me confidence, and I knew that I had done the right thing. And from the time I came into the hospital, everything was so professional, so clean. I cannot thank the staff enough, to be honest with you. I had my own dedicated attendant called Ali, who, such a wonderful, peaceful, calm man, helped me with everything. The nurses were absolutely so beautiful, so compassionate towards me, helped me with everything, from the lady who cleaned the room to the guy who brought in my water every day. I also noticed that the food was way better than I would have had in the UK. And for me, that's very important when you're healing. Surgery was incredible, totally state-of-the-art, top-level surgery. What more can I say? Within 1 week, I am walking without a stick. I'm quite an active lady, and so I feel very, very confident that I will get my quality of life back. And I cannot thank this hospital enough. Everyone has been very, very kind, very compassionate, and very, very professional. Just to say, if I'd have gone to England and had this on the NHS, I would have probably had to wait a couple of years, which is not feasible. Or I would have had to pay private, and that would have cost a lot of money. So I would advise anybody at all to have surgery, to come here to New Delhi. And thank you, Dr. Subash, for everything.
Most welcome. So as you could hear, Sharon, that she was suffering from a hip arthritis problem. And when she came to this chamber a few days back, she was literally limping. And actually she came on a wheelchair, if I remember correctly, because she was tired from a journey and she was in a wheelchair. So when I examined her, her right hip joint was badly damaged and there was barely any movement. And the difference in the hip joint and the knee joint is a point contact joint where you can be at rest without pain. But hip is a ball and socket joint. So in the ball and socket joint, every movement is painful. So even lying down in the bed is also painful. She was lying down with the one leg propped up like this and was difficult to even turn in the bed. Obviously in such a situation, you can't wait for 2 years on a waiting list in a government hospital. And that's the way the system works there, but that's the way the system works in India, where we can accommodate you very quickly for your surgery. So we saw her on that day, we got all the tests done, saw her fitness levels, and we performed the surgery with the Mako robot. And today is, I think, around 8 or 9 days post-surgery.
It's 10, I
10
believe.
10 days
Yeah.
post-surgery. And she's telling me that she's dancing with the physiotherapist nowadays during the physio sessions. So you can understand the kind of improvement she has got in her lifestyle. And this is further going to improve. Now, what are the things which led to this significant improvement in the recovery? So whatever available in the world is nowadays available in India as well. The technology is moving fast. So the Mako robot is one of the leading robotic technology which makes the hip replacement much more easier, quicker, and recovery is faster. The reason being because the hip joint, both the socket and the hip ball, both are moving in different directions. When you're sitting, the socket is moving. When you're walking, the bone is moving, the ball is moving. So to balance that, we get a CT scan before the surgery. We optimize the position of the component according to your body shape and structure, and then perform the surgery with accurate measurements of all the offsets which can help you gaining the full range. And that's what has happened with her. That's one part of the whole surgery. The second part is the approach to the hip joint. So we do the hip joint with the direct anterior approach. So in this approach, there is no muscle is cut, no ligament is cut. So the moment you start recovering from the surgery, you're able to sit on the low height seat, you're able to get up quickly, you're able to walk around, because none of the muscle which moves the hip joint has been cut or stretched or split. That's the beauty of this approach. So robotic technique, along with the least damage to the structures around the hip joint, and then proper hip joint if you use, then you can gain the almost 95% of the range which God has given to you. So you won't say we are God, we can go up to 90-95% of what God has given to you, that 100%. So even if you get 90-95%, that's as good as normal. Because now she wants to start yoga, she wants to start swimming, cycling, walking, all these activities you can do. There are two things which we say don't do them. One is running, the second is jumping, because those are impact sports. So the metal inside the bone, if you hammer that regularly, will lead to an early failure. So these are two activities we tell the patient not to do it. Otherwise, recovery is excellent. You can do all routine activities, you can do all kind of, you can even continue with your physical relations with your partner if you have. Younger patients are having these problems and they have to lead an active life, they have to earn for the family, they have to play with their kids, a little bit play here and there, they can start playing. So all these things can be done, and India is the leading hub for all kind of medical tourism, and Lyfboat is really working very good in this sense. And we've got a lot of patients she's from UK. A few weeks back we had a patient from Australia. We had patients from US as well who were suffering for the knee joint problem, and they came here because they could see that whatever is available in the US is available here, like robotic technique, the best of the implants, and Indian surgeons. I'm telling you because I go to a lot of conferences as a consultant, so I can see that we are earning a lot of respect from the US and UK surgeons, because the kind of difficult cases we do here, they are really impressed with the results. So I thank you, Sharon, for sparing her time. I thank Lyfboat for arranging all the convenience for these patients, and thanks the medical fraternity for allowing me to perform the best of job for our patients. Thank you.